Welcome to the Red Clinic podcast. I'm Dr. Schwalen, licensed psychologist and expert in the treatment of eating disorders. Today, we're going to do what we do best, and we're going to talk about all the different kinds of eating disorders out there. I started a series last week and discussed anorexia nervosa in depth. Today, I'm going to discuss bulimia nervosa in depth. So first, I'll just kind of go over what bulimia is, how to think about it in terms of diagnostic criteria. Really just what are the signs of bulimia, or what are the things that have to be going on in order for someone to be diagnosed with bulimia. Then I'm going to define things a little bit more specifically, just because there's a lot of jargon that I might say when I define what the criteria are. And then I'm going to talk a little bit about medical complications that can be associated with it, and then pretty much move on to the next disorder for the next episode. So last time when I brought up anorexia, I also talked about just like prevalence rates and some of the things that we know about eating disorders, and I'm going to review that today too, just because I think it's really good to always have that kind of in our mind as a framework for why understanding these disorders is so important. So many times I meet with family members or clients in my clinic that really have struggled with eating disorders for a long time. And because family or the client themselves were maybe in denial, or maybe didn't even realize what was going on, or not really ready to accept what was going on, it's really hard for them to wrap their head around the fact that what they were doing was actually criteria for an eating disorder. A lot of times clients and loved ones think like, well, we don't need to like over-pathologize this, or why are we making such a big deal out of it, or doesn't everybody go through phases like this? And so I want to just point out that some of these criteria are actually really dangerous or really specific to having bulimia and need to be understood. And last time we talked about prevalence rates, I really just highlighted the fact that eating disorders don't discriminate. They affect boys, girls, men, women, all ages, all ethnicities and socioeconomic backgrounds. They're all over the world. In terms of where they can be found. We definitely have an understanding for how they are developed, or how they can develop in the Western culture, with societal impacts in terms of the thin ideal and diet culture. And then we also know that eating disorders are prevalent even in young ages. So it doesn't just affect, maybe high school students or college age people. It can affect children as young as 5 or 6 years old. And, some of the youngest that I've treated are actually 4 and 5 years old. And not necessarily with anorexia or bulimia, but there's all different kinds of eating disorders. And so all age ranges are definitely impacted. It's not unheard of to go down as low as 4 or 5. All right, so let's jump into what the criteria for bulimia are. Basically, if you were to consult the Diagnostic and Statistical Manual that we use as psychologists or psychiatrists or just in the mental health field, bulimia is defined as having specific criteria. So there's 5 specific criteria. The first is recurrent episodes of binge eating. An episode of binge eating is characterized by 2 things. So there's like a very specific definition to what a binge could be. It's eating in a discrete amount of time, so usually within like a 2-hour period of time. An amount of food that is definitely larger than what most individuals would eat in a similar period of time under similar circumstances. Okay, so that's just like a textbook definition of what a binge is considered. In a few minutes here, though, I'm going to talk about what I'm seeing clinically, because just because it's kind of written in a book a certain way doesn't mean that it really translates to real-life examples of what this looks like. But that's the book definition, okay? And then the second part to a binge is that there's a lack of control, or the person has this sense of being out of control. So they engage in overeating, and the episodes really feel like they can't stop during that time frame. They can't stop, they can't control how much or what they're eating, and then they usually feel pretty bad about it afterwards. So there's like this guilt or shame that's associated with eating the large amount of food or the types of foods that they just finished. The second part to bulimia is the purge. So, I actually just defined what binge is, but let's talk about that word real quick before I go into purge. The word binge is a word I think that society these days, especially in Western culture, has become extremely desensitized to. So if you think about how we use that word these days, we use it, around the holidays in terms of it's Thanksgiving and I'm going to restrict all day or fast all day so I can binge out later on Thanksgiving dinner. So that word is commonly used kind of in that example. Another way that we use it is when we talk about Netflix or our favorite shows, right? We're gonna go on a Netflix binge, or we're gonna binge on our favorite episodes, or whatever it is that we say. But we tend to use that word in a way that kind of takes the seriousness away from it. It's kind of like the word love, right? We kind of apply it to every situation in our life and it loses its meaning. So one of the things that I actually work on with families and support people when they're working in helping a loved one reach recovery is thinking about the way we use certain words and making sure that we're using them specifically in a way that honors exactly what it actually means for the person that's struggling with that behavior. So purge is another word I think that has lost its meaning. We use the word purge a lot when we're talking about spring cleaning. I'm going to do a huge purge and get rid of all the junk in my house. Or some people will use the word purge just to describe other aspects of what they're doing in their life. A lot of times it's like this clean out process that they're describing. The purge in bulimia is defined as any kind of compensatory behavior. So it means anything that someone could do to compensate for the fact that they just had a binge. Or not just a binge, but just even taking in any kind of calories. So it's an inappropriate compensatory behavior, and the goal is to prevent weight gain. So usually what people associate when they hear binge, purge, and bulimia is someone who may binge eat and then self-induce vomit. That's what most people are very commonly aware of when they hear the word purge and we're talking about an eating disorder. Other types of purging behaviors that people with bulimia may engage in also include the misuse and abuse of laxatives, diuretics or other medications, fasting, so engaging in a binge and then maybe not eating for a very long period afterwards, hours, sometimes days. And then also over-exercising or excessive exercising. So I want to break that down even more too, because I think it's really kind of the unknown parts of bulimia or even any eating disorder that I'm really touching on right now. Most people understand, okay, to purge, you just induce vomiting, but not a lot of people would think using laxatives or exercising as a purge. How does that work? Over-exercising is really tricky because you have to really spend a lot of time with the person to understand what it is that they're doing and how to characterize it as whether this is too much exercise or not. Usually, as a clinician, I'm looking to see if the person is engaging in exercise, usually immediately after eating something or shortly after eating something. I'm looking to see, is it more than an hour a day, not being required by a coach or some organized sport. I want to know, is the person exercising even through an injury? So they're not letting themselves time, giving themselves time to rest. They continue to push through the pain, and they're not really healing well. I'm going to look for things like not even really taking any days off from exercise. Also, what does it feel like if you're not able to exercise? Are there extreme feelings of guilt associated with it, or feeling regretful that it didn't happen that day? Does it kind of leave the person preoccupied with this feeling of failure because they weren't able to stick to their exercise routine? does it interfere with life? Does it get in the way of social activities or getting other things completed or accomplished because they have to get that exercise in? And then the other thing I'm going to look at is it solely for the purpose of managing weight? Do they find any joy or any kind of enjoyment out of the activity, or is it truly associated with trying to prevent weight gain? So those are the things I'm going to look at when I hear about exercise and maybe it being used as a way to purge. Now, the other criteria that are associated with bulimia per the DSM is that the binge eating episode and the compensatory behaviors both occur on average once a week for at least 3 months. So we're always looking at like time frames and how long they last and how long it's been going on in order to determine whether or not this is truly like a clinical disorder or maybe something else that could be happening. The person who has bulimia usually has a very negative perception of themselves, so very negative self-evaluation that's influenced by body weight and shape. So they're very focused on body, they're unsatisfied with it, they believe that they're fat usually, and all of these behaviors are to prevent weight gain. So there is that fear of weight gain. Bulimia has that in common with anorexia. And then obviously we have to rule out other eating disorders. So the thing that the DSM says is that if someone is binging and purging, it's also not during a time when the person could be experiencing anorexia. So I want to talk about the different binge types of episodes that I've seen lately here with clients that are coming into the clinic. You know, I defined it per the DSM or per the textbook definition as eating much more than someone would usually in a 2-hour period of time. And that's kind of a more old school way of looking at it. You know, this is the type of person who may have like a very classic relationship with binge eating. It looks like, you know, I crave sweet and then I crave salty. So I might eat like a box of crackers or a bag of chips and then I'll go and get a gallon of ice cream. Or maybe I mix sweet and salty things together and eat them at the same time. And during the entire time that they're eating, they feel out of control. They're eating very large amounts of food. So this is like a whole pizza and then a whole gallon of ice cream. And they're not stopping until maybe they feel really uncomfortable or they feel really sick. And a lot of times when I talk to individuals who are purging, they will also know the types of foods that are much easier to purge. So they may tend towards pizza, ice cream, those types of foods because they are easier to throw up than other types of foods. Now, I've also seen binges look very differently than that example. Because of the pandemic and also because of how we have the world, you know, at our fingertips, with apps that you can go into and just order food and have it delivered to you. Binges can look really different in terms of just being really, really expensive to engage in. So someone who's using an app to order food may order, you know, up to $80 to $100 to $150 worth of food, have it delivered, sit down and eat it all in one period. A lot of times when people engage in binge eating, they describe feeling like, you know, that feeling of being out of control, but also that feeling of like almost having this compulsion to eat everything in front of them. So the idea of leaving something behind or packing it for later to have leftovers, it's almost unbearable. It's like, I can't save it for later. It's there, so I have to have it now kind of thing. So I've seen that kind of binge eating. And then another type of binge eating that usually gets described when clients come and talk to me about it is maybe they're going to different drive-thrus on the way to work or on the way home from work. So they might go to one drive-thru and order a meal, and then they might order another one and eat 2 meals from the same place, or they might drive down the street to the next drive-thru and order another meal on top of the one that they just finished. And so, again, it's like an excessive amount of food in a short amount of time. It's more than most people would eat. And there seems to be this real feeling of not being in control and having this compulsive urge to engage in that behavior. Now, the purge, if it's self-induced vomiting or even use of laxatives or exercise, usually, and even restricting, so deciding, well, I was bad this morning, right? I ate too much, so I'm just not going to eat until tomorrow. Those types of compensatory behaviors generally happen right after the binge. So it's usually within like the first 30 to 45 minutes of the binge, no later than that, is usually what clients are describing. And so, for parents out there or for adults supporting another loved one with an eating disorder, I always say, if your child or your loved one has a history of purging, just kind of monitor them right after eating. Because if you're noticing that your loved one is running to the restroom after every meal or kind of disappearing because they're running up to their room to work out or exercise or do something, then they may need to be on some kind of restriction where we give the body enough time to allow the food to digest and absorb and all of that. And that urge to purge is something that the person can overcome rather than giving into it. Because that's exactly what it is. It's just this uncontrollable urge where it almost becomes so solidified or ingrained in a pattern of behavior that it's almost uncontrollable, just like the binges. Now, most people will also talk about exercise, for example, if they're using exercise as the way to compensate. It's very interesting how they'll describe their use of it. So it could be going on very long runs, but it could also just after every single time they eat, going into a private space, getting away from the people in their life so that they can, bust out a few push-ups, sit-ups, squats, and break a sweat. But they're doing this numerous times a day after every single time they're eating, and that's how they feel better about the fact that they've just ingested some calories. Now, the other thing that I want to bring up about purge behaviors is that a lot of clients will talk about the fact that this brings them some relief. So bulimia is a very emotional disorder. Even though, it may seem like there are lots of rules around eating disorders and that there's some kind of method behind it, all of the eating disorders are considered to be very psychologically and emotionally driven. And so bulimia is a very emotional disorder. We know that bulimia tends to occur in people who are usually more dysregulated than not. So they may feel a lot, they have a lot of big feelings and experience a lot of emotions, but they don't necessarily know how to regulate their emotions. And so maybe because of some really horrible traumatic event that occurred in their life or some other issues that are going on, they're just not emotionally very regulated. And so if you look at how they experience their eating disorder, it's also not very regulated. In terms of experiencing emotions for people with bulimia, we tend to see this almost metaphor of stuffing feelings down. That's kind of what the purge represents. And then getting relief by doing a really big purge afterwards. And so getting it all out. And this is where that emotional connection is made in therapy. And we have to really work through that for a client with bulimia to teach them how to self-regulate and cope with their emotional experiences. The other thing that we tend to see with clients who have bulimia, more so than other types of eating disorders, are self-harming behaviors. So people with bulimia also very commonly present with maybe cutting behaviors or even head-banging behaviors, slapping themselves, pinching themselves, peeling the skin off their fingers, and in a way that's kind of self-harm. And so they will describe a lot that because they're kind of numbed out or doing everything they can to stuff their emotions down, it brings them some release from that pain, the emotional pain, to then focus on the physical pain that they're inflicting on themselves. So usually people who self-harm are generally tactile people. And in therapy, we're going to work with them on helping them learn how to ground with the sense of touch, but not through self-harm. So maybe we'll replace that self-harm through putting something in their hands, like a stress ball or some kinetic sand, or doing something that still gives them some kind of physical relief or physical association for relieving that pain, but without actually hurting themselves. Now, the other thing I want to do today is talk about the medical complications that can be associated with bulimia. I'm not a medical doctor. I am a psychologist, but it's still always in my awareness what could be going on with somebody from the medical perspective, because I do treat eating disorders. And eating disorders are very much a psychiatric illness, and then there's all the medical complications that come from it. And so having the awareness is very important, because like I always say, if someone's not appropriate for outpatient level of care, I'm absolutely going to let them know, because my number one agenda is to keep them safe and stabilized. So medical complications that occur with bulimia, there's the parotid gland hypertrophy. This is just a fancy way of saying the swelling of glands in someone's face. So often I have met someone who's been purging, so they're self-induced vomiting, and they have these little chipmunk cheeks almost. And that's just because the glands in their face have become swollen from the vomiting. And they actually believe that they're gaining weight or that it's not working, and so they need to keep doing more of it because they're having the opposite effect of what they're trying to achieve. When I've explained this to clients in the past, they have been so overwhelmed with that information that it was actually the vomiting behavior that was creating this swelling in their cheeks or in their face, that they almost didn't really know what to do with it at that point. It was, we need to find replacement behaviors for binging and purging. We need to deal with your emotions in a healthy way. And we can, for the most part, reverse a lot of these side effects from the binge purge cycle. There is dental enamel loss that's commonly associated with bulimia as well, because of the acid that comes up from the vomit over and over again. It can have an impact on someone's teeth. There's also complications that can occur with the esophagus. Our number one question that we'll ask on an assessment or an intake is, have you ever vomited blood? And the reason we're asking that is because we know that if there is some kind of tear or something happening with the esophagus that's causing blood to come up in their vomit, it's extremely dangerous. And at that point, we would just stop the assessment and say, you need to go to the ER at this point because you are actively vomiting blood. There are electrolyte imbalances that can occur when someone is inducing vomiting or even abusing laxatives on a regular basis. There are heart complications. So there's arrhythmias and even cardiac failure that can occur. So this literally means even kids are susceptible to having a heart attack if they're engaging in frequent and regular binge purging behaviors. There's also the risk of aspiration pneumonia, which is literally inhaling vomit, right? And so those are just some medical complications that can be associated with the binge purge that occurs with bulimia. Now, another thing I want to bring up, because I've actually seen this a lot here lately with some clients of mine who are reporting that they've had bouts of bulimia in the past, but they're better now, or they're not struggling currently. And this is more common lately. I've just been hearing more of it, where even parents are calling in for their children, and I'll ask them, do you or anyone in the family have history of an eating disorder? And they'll say, well, like most 20-year-old women, I experimented with it. It's almost this thing that's like almost normalized and minimized. So it's not that big of a deal and everyone's doing it, right? Well, that's not the case. In fact, it's only about, 1 to 4% of the United States population has an eating disorder. So it's not everyone's doing it. It is not a normal way to engage with your body, to experiment with throwing up your food so that you don't gain weight. So parents have been telling me this, that they've dabbled in it or experimented with it or definitely were meeting criteria for bulimia at one point in their life. And then when you ask them about it now, like how does it come out in your day-to-day these days? It's, oh, I go to the gym, or I'm a clean eater, or I have really strict rules about what I allow in the house, no sugar, no desserts, no things like that, no sodas and soft drinks and things. And so you kind of see that there's still very much this like disordered thought process, or this preoccupation with food and what's healthy and what's not healthy, and it's impacting the way they're raising their children. It just may not be so much in the form of actively binging and purging. So that's like for parents. But when I'm interviewing, college age students, for example, they can pinpoint times maybe in junior high or high school where they were binging and purging so frequently that they would get dizzy and pass out on a regular basis, or they wouldn't even have to make themselves throw up anymore. They would just eat something and it would automatically come up. That's usually a sign that they've been inducing vomiting very, very regularly, to the point where they don't have to do anything anymore and it just starts happening on its own. And then they'll say, then I got through high school and graduated and everything was fine for a while. I was just mostly watching what I ate and worked out, but I wasn't purging. But then I got to college and it started up again. It was a stressful time. I was getting used to being on my own again. And so I started binging and purging again. But now, I'm about to start my new job. I've graduated from college, and yes, I still have really poor body image and hate myself, but I'm not binging and purging anymore. So I don't really have a problem with an eating disorder. And the issue here is that actually there's still an eating disorder present. If you look at your history, you have a propensity to kind of like ramp up in your behaviors, and then they kind of settle down, and then life gets stressful again and those behaviors ramp back up. And if you've never received treatment, I'm going to recommend that we actually treat you for an eating disorder, even though you may not actively be engaging in those behaviors right now. Because who's to say when life gets stressful again, which we all know it will, you're not going to see an increase in those behaviors again. So that's the interesting thing, I think, about bulimia. There's this up and down to it. There's this like stuff it down, purge it out. There's an increase in times when individuals will see the behaviors occur, and then a decrease where things settle out. It's kind of just the way it works with clients, for the most part, that I've treated and in my experiences with treating clients with bulimia. There's also that emotional dysregulation piece. Self-harming's usually, or can be, a part of it. And maybe someone's not actively self-harming, but maybe they've tried it out in the past. And then also the trauma that goes along with it. I've seen a lot of clients with bulimia have some pretty intense trauma experiences that they've had to endure at some point in their life. So anyways, that's what I have for you today for Bulimia Nervosa. Next week, I'll pick a different eating disorder and give you some more details on that. But that's it for today. Thank you for tuning in, and I can't wait to see you again next week.